Morning everyone, from me too. My name is Lucy Griffiths and I'm based at Swansea University Medical School. I'm going to give you a brief overview of the project first of all. So first of all, I'd just like to acknowledge the wider team. So this is a collaboration across 5 institutions. And of course, we're very grateful for the funding that we've received from Foundations and Administrative Data Research UK. So these are the overarching project aims. We receive funding for 2 years. And it's a 2-year programme of networking, information sharing to foster closer collaboration between those working in children's social care research. So we have 4 work packages. The first involved the evidence review and in-depth stakeholder engagement work to outline research priority areas, which has shaped our research agenda, which you'll hear about today. And we also aim to kind of support closer alignment of that research agenda with stakeholder priority areas. Then our second work package aims to support capacity building for researchers using administrative and other large-scale data sets. So we're in the process of developing a web-based one-stop shop, and that's recently been launched on the ADR website under their community section. So our recent published reports have been uploaded, further content to follow, but also please let us know if you have related research that you'd like us to signpost as well from that website. So this area aims to raise awareness of the value and the availability of different ADR resources, hopefully to attract new community members and also to forge greater collaborations between those already using the existing data. Our third work package aims to try and strengthen and expand the ADR research community. So we are planning a number of networking events, and this is our first Catalyst Forum today. And the events will focus on the ADR Flagship datasets and use cases, and we see our role very much as convening and bringing together relevant experts and audiences over the next year. So we hope that our workshops will support individuals who are new to administrative data research and to facilitate collaboration between researchers. And then finally, we were funded for a new research fellow who's been recruited and is currently using the eChild database within the UCL team, and that researcher is exploring some of the evidence gaps that we've identified in the scoping review. I'm going to pass on to Grace now. Thank you.
Hi everyone, I'm Grace Bailey and I'm a researcher at Swansea University, and today I'm going to talk to you about the scoping review that we've undertaken as part of the Community Catalyst. So the information that we have about children at risk of poor outcomes at the moment doesn't necessarily capture and address the issues that are important to policymakers and practitioners and families, and it's quite scattered. So we, as part of the Catalyst, we've undertaken a scoping review to map the evidence and identify any gaps in the literature. So the scoping review has incorporated all published literature that uses admin data between 2000 and 2023, and this was specifically focused on children involved in children's social services. So although this is only a small category or group of children who are potentially at risk of poor outcomes, these are who we focused on. So as part of the scoping review, we identified 142 publications. 92 of these were peer review articles and 50 of these were grey literature, and this was just in the UK alone. So as you can see, over time we've seen this increase in admin being used for research purposes, which probably aligns with the sort of use of trusted research environments and availability of ADR flagship data sets. Next slide please, Lucy. And so as part of the scoping review, we mapped across the UK, and as you can see on the left, the majority of the evidence was from English data sets, particularly the National Pupil Database. And this is probably because it incorporates the children in need census and also the children looked after data sets. And then on the right, we can also see in yellow, a large proportion of the publications looked at children looked after. So we've kept with the terminologies that were available within the literature. So we've got 3 subpopulations: children looked after in yellow, the child protection and protection register and child protection plan in the green, and then in the sort of blue colour, children in need. And these children vary in the level of support and care that they receive. So as I said, children looked after were the main focus of the research with 80. But also you can probably see in the overlap, there were 24 studies which looked at children in need, child protection, children looked after, and these studies tended to draw comparisons across the 3 subpopulation groups. Next slide, please. So for the next 2 slides, I'm going to talk about the findings that we pulled from the scope and review. This slide, the key findings, and then I'll go on to talk about the tentative, more weaker findings. So from the review, some of these findings might not come as a surprise for you, but we found strong associations between deprivation and increased risk of children being involved in children's social services. This was across the 4 nations, and the evidence tended to be strongest for children looked after. We also found that children who entered care later or as an adolescent tended to have more problematic trajectories. So they tended to go on to have poorer educational outcomes, more unstable reunification with families, and placement instability as well. But we did find that placement instability wasn't just an issue for adolescents. There was a rapidly rising number of younger children who were going on to have 2 or more placements. We also pulled out specific themes. So one of these themes was educational outcomes, and we found across these 3 subgroups of children involved in social services that they tended to have high proportions of special educational needs and disabilities, and the type of SEN that these children had did differ depending on the care and support they were receiving. And as I've mentioned already, they did go on to have worse educational outcomes. In particular, this related to poorer attainment and also increased exclusions from school, absences, and more school moves. We also found that there was a lot of evidence which showed that children involved in children's social services had greater mental health. There was, again, this was found across all of the 3 subgroups, but it did tend to be more prominent in children who were looked after. And we also found some evidence of poorer physical health. So in particular, this was increased risk of hospitalizations for preventable conditions. And lastly, we did find a large body of evidence which looked at familial risk factors and vulnerabilities and how these were associated with children's involvement in social care. The evidence did tend to be weighted more towards maternal risk factors, but there was some very limited evidence on the fathers. Next slide, please. And then in regards to the sort of weaker findings, we found some research looked at minority groups, in particular ethnicity. However, this was more descriptive and really lacked that in-depth analysis. There was also very little which looked at unaccompanied asylum-seeking children, and we didn't find any evidence to look at religion or faith. And although it has a large impact on the services that children receive, we didn't find much evidence which looked at rates and spends in children's social services, and this is probably due to the sort of lack of admin data. The studies that were available tended to link to survey, so the workforce surveys. So this was an area that could do with further research. And I've sort of mentioned already, children were more likely to have a SEN diagnosis. However, there was very limited evidence that looked at how SEN diagnosis can change over time and how this can impact educational outcomes as well. There was some evidence which looked at intergenerational vulnerability, so whether the parents themselves were involved in children's social care, but this was very limited to descriptive studies and there wasn't much in-depth analysis again. And so we've recently had the release of the MOJ and DFE linked data set, so potentially there may be future studies in the pipeline, but there was very limited research which looked at how children were involved with both the criminal justice and the children's social services. And of the studies that did, this tended to be focused on the child and there wasn't much looking at how parents as well themselves might be involved in criminal justice. And then lastly, again, potentially due to the limitations in the data set and the longevity of it, there wasn't much information on children once they leave care, how their health may deteriorate as they go into adulthood. There was some studies which looked at unemployment and benefit receipt, and these children were at greater risk of poor outcomes into adulthood. And so lastly, I'm not going to go into too much detail on this because I know Karen's going to spend a lot of time on this later. But from the review, we pulled out some of these key themes. So one of the things we noticed that we lacked was the child's holistic journey, so into and through the care system. So it was unclear what type of support the parents had been offered, whether they'd been offered this at the right time. And there weren't many studies that looked at how the child's needs may have escalated from early intervention into the more severe, where the child becomes looked after. I've already mentioned that we had strong evidence for deprivation, but this tended to be at an area level. There wasn't much at the household level. So how does this affect the journey of the child through the care services? Again, I've already touched upon minority ethnic groups and unaccompanied asylum-seeking children and faith. A lot of this research was descriptive, but it would be really much more informative if we knew more about their pathways through the care system, their outcomes. Are they more or less likely to receive interventions from children's social services? Spend and workforce turnover, really important. We've got high rates of vacancies in children's social care services. How are these affecting the care and support that the children receive? A bit more harder to obtain or ascertain through admin data for school disengagement, but really it would be really relevant and interesting to see how this links with broader disengagement within the family and their involvement with children's social services as well. And then lastly, just very quickly, two really important topics that we felt because of their risk factors and their association with children becoming involved in children's social services was domestic abuse and disability. These topics can be quite hard to examine using just the social care data alone, so you may require this extra linkage towards other data sets, in particular health data sets, but these topics really, we felt, given their importance, lacked the research behind them. And then lastly, a sort of new topic a new area or concept that we found was admin data being used as an evaluation tool. So for example, how effective is it in looking at early intervention, such as the family nurse partnership? But we felt that this was something that really could be explored and used further.
Thanks, Grace. So my name's Kat Tranter. I'm a research associate based at Lancaster University, and I'm this Catalyst lead for stakeholder engagement. I'm going to briefly share now some of the key views and messages that we've gleaned from stakeholders through our research group's stakeholder consultation process. So next slide, please. So yeah, 37 interviews have been conducted and recorded across different stakeholder groups, with stakeholder participants recruited purposefully by research team networks and with some additional support from ADR UK's public engagement team. We really wanted a spread of perspectives, so stakeholders were recruited from a range of sectors and organisations, which were assessed by the research team as being likely to offer useful insight into the matters that we wish to consult on. So as you can see from the slide, this covered a range of sectors and categories, and these were the organisations that we consulted across. We aim to interview those in positions of senior strategic operational leadership who could speak more broadly on behalf of organisations and with experience. So people may have been, for example, data intelligence leadership professionals, policy colleagues, and those leading children's service delivery. Next slide, please, Lucy. So what do we ask stakeholders? So as you'll see from the questions on the slide, one of the main objectives of the exercise was to enable the research team to get really close to frontline experience in respect of current concerns about children and how they felt services were responding to these. Alongside this, we wanted to consider what information and evidence exists about the scale and nature of these concerns and where gaps are sensed to potentially be. We wanted to hear about local, regional innovation in relation to the development of approaches to data sharing. And we also asked stakeholders if their organisations were able to make effective use of national children's data, both government statistics and ADR UK flagship datasets. And participants taking part in interviews, together with the wider research team, ADR England representatives and members of the steering group, were invited to a roundtable in September 2024. This was to consider the main findings of this consultation process. So points of discussion and feedback have then been further integrated into the stakeholder consultation report. Next slide, please, Lucy. So I'm going to turn quickly to sort of the headline kind of findings and key messages. So one of the really striking things throughout the interviews was the extent to which kind of the context of family life, particularly in relation to poverty and hardship, was uppermost in stakeholders' minds, and the extent to which services across sectors were perceived to be fundamentally overstretched. So family poverty and the challenges of the ongoing cost of living crisis were discussed consistently by our stakeholders. And this was coupled with a really highly challenging context of practice across all services. So not just children's social care, but also health services, education and justice. So stakeholders were giving us a sense that they wanted better evidence about the scale of difficulties and how their areas potentially compared to other regions. So stakeholders described reduced service capacity to meet many of the needs of children and young people at risk of poor outcomes across these sectors. Multiple examples were shared of really creative ways that services were trying to bridge the gap, and there was considerable value placed on voluntary and informal sectors. But overall, stakeholders felt that many children are just not receiving the help they need at a timely point, leading to an escalation of their difficulties. We also repeatedly heard from stakeholders about the challenges facing service providers due to staff recruitment and retention difficulties, resulting in inexperience and instability in the workforce. So stakeholders were arguing that more than ever, difficulties within one single sector regarding the workforce are being replicated across several sectors. They want to know more about workforce profiles generally and also spend capacity across services. Stakeholders were also in complete agreement and spoke at length about the effectiveness of early intervention potentially and how it can make such a difference to children's lives to reduce or prevent poor outcomes, including family breakdown. However, they were also in agreement that there's currently insufficient investment in timely help to support prevent problems escalating. So stakeholders were stating that to avoid reactive crisis-driven practice that they were often seeing, insufficiencies in early intervention need to be addressed at a national level, and they'd welcome a stronger evidence base around the scope and effectiveness of early intervention. So in addition to contextual factors, a number of key concerns were also spoken about. One of these was family mental health. So consistent across interviews was a concern for children and young people's mental health. So this includes really long waiting lists for assessments and treatment, in addition to scarcity of more specialist provision. But stakeholders were also really worried about how mental health needs of parents and children might interrelate, and hence we're referring here to family mental health. So stakeholders described declining family wellbeing as a result of more than a decade of under-resourcing of services. They felt very much so that there was a sense there was greater mental health need within families and across generations, but without the provision to meet the increased demand. Stakeholders also reported really significant concerns about rising levels of special educational needs and disabilities. In particular, a sense that there's an escalation in speech, communication and language issues, and the cohort of young people with diagnoses of or awaiting assessments for neurodiversity were discussed frequently. And it was felt often that cross-sector provision doesn't seem to be meeting increasing demand in this area in particular. There was also a lot of discussion within interviews about there needing to be a better understanding about the relationship between childhood neurodiversity and potentially how this connects to childhood mental health and additionally patterns of school disengagement. So on school disengagement, this as an isolated concern was raised and highlighted by most stakeholders as a persistent challenge. And they noted a marked rise in school disengagement since the COVID-19 related lockdowns. So stakeholders were emphasising concerns that their organisations and those that they work alongside are seeing somewhat of a breakdown in what could be called the social contract between families and the state, and they wondered whether school disengagement was partially symptomatic of this. In relation to children in care and care leavers, stakeholders within our interviews stated that they continue to be concerned about the vulnerability of children in care and care leavers generally. They recognise that there's usefulness in terms of national data in relation to understanding local and national scales of care placements and placement changes, but they felt there was insufficient data on particular cohorts of children in care and care leavers. So specifically, stakeholders were concerned about children from minority ethnic groups and unaccompanied asylum-seeking children. Also, children in care and care leavers who require access to specialist mental health provision. They were highlighted as perhaps insufficiently visible, really, and who greater prioritisation across policy, research and cross-sector practice would be welcomed. In relation to care leavers as well, stakeholders would like an up-to-date picture, really, in relation to their finances in the context of the cost of living crisis. So additional themes were also raised across the stakeholder consultation, and these include concerns relating to domestic violence and abuse and extrafamilial harms. And although these two concerns were raised less frequently by our research participants, where they were raised, stakeholders were indicating that these two concerns and issues are widespread. And regarding both domestic violence and extrafamilial harms, they emphasised a felt sense of a lack of robust quantitative research and analysis. Next slide, please, Lucy. So stakeholders also shared their views in relation to research, collaboration and data developments. Consistently across interviews, stakeholders recommended that research needs to pursue a much more holistic view of the child. At present, data held about children by organisations working within and across and alongside children's social care, so that's health, education, justice, was felt to be unhelpfully fragmented, really. Stakeholders also think that a lot of outcome information is highly process focused in relation to children and young people. They want more meaningful outcome information. They'd like to see more longitudinal outcome information in particular to help better understand service effectiveness. And this notably included the perspectives of children and families in relation to service effectiveness. Stakeholders want research to be relevant, current, informed by policy and practice expertise. They're really welcoming collaboration, so that everybody can work together in a way that retains data's meaning and relevance for policy and practice. And stakeholders did speak about, really valuing national data sets and national research, of course, but they stated quite frequently that there's a wealth of data held locally or regionally that was felt to be insufficiently used for research and analysis currently. They'd welcome a greater dialogue between stakeholders to create more data assets, new data assets at these local, regional levels. And finally, there's a wish to see much more consistent inclusion and facilitation of children and family perspectives generally across research, particularly at the design stages, and in contributing to definitions, categorisation and prioritisations of research topics. And I'll just put on the final slide, Lucy, I've just picked out a handful of participant comments from the consultation just to bring it to life slightly for you. Thanks.
Thank you so much, Kat. Our presenters are doing an excellent job of keeping to time, which does mean we have 1 minute if anybody wants to ask a clarifying question. So I'd like us to hold back on discussion for the latter part of the webinar, but if anybody has any clarification questions, there's a few in the chat already, which the team are helpfully asking. Any urgent clarification questions, please just put your hand up. Cecile, is this a clarification question? How outcomes can be made more meaningful, or is this a question for discussion? Clarification question from Cecile. Could you explain how outcomes can be made more meaningful, please? So this is the previous slide, Kat. Increasing meaningful outcome information. Can you explain what that means?
Yeah, so in relation to how stakeholders were sort of framing meaningful, I suppose less snapshot. Yeah, so less kind of instantaneous, more thinking about experiential outcomes, and that's where the perspectives of children and families maybe come into it. Lucy, did you want to?
Yeah, I'd also say, Kat, sorry, I'm a bit croaky today, but I'd also say that also focusing on resilience and positive outcomes as well, and how we can support those insights through the research.
Yeah, and I guess it's shifting the lens from service outcomes to outcomes that matter to children and families. We can come back to this point, Cecile, at the end, though.
Great, thank you. In that case, I think, Karen, I'm handing over to you.
Yes, you are. Thank you, Aoife. So I'm just going to go through my first slide with you all. Hello, everyone, and thanks to Kat and Grace. And then I'm actually going to turn my camera off because I've had a message from our email message from our local internet provider to say there's a problem. So, okay, hoping to get through this. Okay, so what I'm going to do now is go through the research agenda with you all, which is a integration of learning across the things that Kat and Grace have shared today. Okay, so on the first slide, there's a kind of recap of the messages, but I think these are really fundamental and important messages for all of us in the ADR community. So Kat was saying, you know, let's get beyond this fragmented picture. And I think this is really where we as researchers and the work that ADR UK has done is so important, because obviously people who are running particular services have a view of children. But what's much harder to get is cross-sector evidence. And I think this is where all the investment in the linked data sets will now and over time generate a much more holistic view of the child. So here we have again, deliver cross-sector evidence and information about children's pathways through services and outcomes. And we know children are usually involved with a number of services. The other point is really builds on what Grace was saying, is that, you know, there's a real need to kind of move our research upstream. I'm going to say a bit more about that. But obviously, all of us want to prevent families getting involved in crisis services, very expensive reactive crisis services and care. But at the moment, the balance of evidence is really towards that end rather than earlier intervention and prevention. The other point I think that came across really strongly from Kat was about collaborating to produce evidence. I think this is really essential, right from the framing of our research questions, even before that, through to our understanding of data, our interpretation of data, and our shaping of any recommendations. So we're talking about a really important and deep collaborative process that's not just a bit tokenistic, but actually is a proper reciprocal arrangement. Okay, the last point I want to make, just an overarching point, is that we know that the ADR UK flagship datasets have absolutely created huge opportunity for this community, and there are opportunities now for everyone on the call, etc., to be using that data. But we also know that there's further work to do. So some of the research agenda I'm going to outline really does emphasise where there are some further national data asset imperatives in terms of development. Okay, thank you, Lucy. Can you hear me all right, Lucy? Is everything going smoothly so far? Good. Phew. Okay, so the next slide then, please. So just to summarise, so what we've done from the work that Kat and Grace have led is to put together 10 key topics. And here you can see them all. I'm going to do a little bit of interactive voting with you later on these topics. But what you can see at the top is we have put early help and children in need, household level hardship. And then that combination of family mental health, special education needs and disabilities, school disengagement, service workforce, those 6 at the top we feel were absolutely consistently discussed, referenced, cited by our stakeholders, and where there's a real imperative to do more. Okay, sorry, I've now got a dog barking. It's going to be one of those days. Okay, so let's now go on to the next slide, please. Okay, so let's talk about achieving a better balance. Can you hear me all right? Yeah. Okay, good. So basically, at the moment, what you'll have seen from the really helpful diagrams that Grace presented is there's a serious kind of imbalance, if you like. So this is not to in any way negate or not value the work that's been done on children in care, which is incredibly important. But it's to say that actually currently the balance is at odds with an emphasis on policy on prevention. So successive governments as a cross-party, if you like, commitment to prevention. But we're not seeing that. Now, some of that is to do with the fact there's been lots more foundational work done on children in care, data issues, which have already been discussed in the chat around early intervention, but that's something for this community to get hold of. Okay, so what we want to do is we want to understand much more clearly how to prevent children from escalating and moving downstream towards care. And we want to do what we can to use our current data sets, but also look at, what do we need to do to develop our data assets so that we can answer those more challenging questions about services and about longer term outcomes. Okay, so let's move on to the next slide. So this next slide is also, I think, pretty critical for this community. And again, it's not necessarily the easiest to answer, but we know that there's some really pioneering work already going on in this space by colleagues at UCL, but also by Professor Rick Hood at Kingston. So what we take from Kat's presentations is very, very strong, is stakeholders painting a picture of increasing hardship and hardship at the level of the household. Much of the work that's been done has used area level measures, and I know colleagues on this call, Devara, I noticed you're here, you might want to say something about this, are trying to complement that with household level measures as well. But I think that's where this needs to go. So if we're thinking about lots of questions that are very topical about household level poverty, about the contribution from the state, for example, in relation to the two-child benefit cap, all of these things require us to look at the household as well as the area. Okay, so I'm not going to say anything more about that, but it might come later in discussion. But we are going to have a workshop dedicated to this question as well. Okay, so let's move on to the next slide. So, okay, I've grouped these together, and I've purposely grouped them together, but there's serious concern about family mental health, SEND, and school disengagement. So what Kat and Grace have highlighted, this is a major concern, and there are gaps in the evidence. So Grace usefully indicated where research has been done. So it's not a kind of desert, there's some great work out there. But what stakeholders are really concerned about is what's the overall burden of mental health and need within families. So this is a slightly different intergenerational question. So often when we think about intergeneration, we think about, do the children of parents who've been in care go into care themselves? But actually, if we also think about what's happening within families across generations, this is a really important question and message from our stakeholders, is what's the overall burden, if you like, of mental health need within families, across children, across families, across grandparents? Can we use data to capture that? We know, I mean, it's extremely widely documented that we're seeing increasing rates of SEND. There's more to be done to understand that, specifically in relation to children's social care. We need to know more about changes over time, interaction with diagnosis, service availability. So a complicated picture here. And of course, we want to understand that in relation to mental health, hence me grouping these together on this slide. Again, it's extremely well documented that school disengagement is an issue, but we know this is also cutting across socioeconomic class. We know that it's a complicated picture. School disengagement for one child might be quite a different issue for another child. So again, it's about differentiating our populations, and it's about trying to look at how these things are interacting. So my final point on this slide, and again, I think this is where we're going as an ADR community, is to get beyond siloed or fragmented thinking and say, what can we do with this data now and in the future to capture a more holistic picture? So stakeholders welcome research which captures interactions between, for example, mental health, or SEND, school disengagement, and of course, poverty and hardship. Okay, thank you, Lucy. Next slide. Okay, so services and workforce. Again, it's a long-standing issue. This probably won't come as a surprise to you, but lots and lots of debate, lots of contention about where we should invest. Obviously, what are incredibly straitened resources nationally. But we need an evidence base really to kind of understand what actually is going on. You know, we're struggling with baseline data, and we're struggling therefore to understand the impact of policies and changes. But we know that across a number of services, staff turnover, staff vacancies, etc., are impacting on our children's social care population. Again, I think one of the things that's really emphasised, came through from Kat's talk, is that stakeholders again would like to know what's the combination of insufficiency here. So if we took a child's mental health, what's the combination of factors that are creating insufficiency in meeting that child's needs across sectors? And is that different? Is that changing over time? What's the impact of changes to policy and practice in this space? Okay, next slide, please, Lucy. So I'm keeping this very simple, but we're obviously open to questions at the end. So just want to say that in relation to that kind of really consistent theme about looking beyond fragmented picture of the child, there are some really great opportunities now. So having covered what I'd say the top issues for our stakeholders and that have arisen in relation to gaps in research, I'm now going to just flag about another 4 slides with issues for you to think about. So we do now have at our fingertips opportunity to use data to look at dual system involvement in relation to criminal justice, family justice, and education. So I'm just flagged here for those. Many of you on this call will already know about the Data First programme, where you can really begin to get hold of cross-justice. The ADR UK Fellows have done some fantastic work to produce data insights, and obviously we're linking to that through our microsite, Catalyst microsite. Just to flag again, the MOJ DFE data share and the work of our fellows such as Katie Hunter, who've begun to help us understand and tease out some really important insights from that. Okay, so next slide, please, Lucy. Okay, so let's move from, so if you like, I think a place where we've made really quite good progress, which is around cross-justice, to this really big issue of domestic violence and abuse. I know that many of you on the call will probably be quite interested in what we can do in this space, but so far there are major challenges in piecing together what is linked, what is potentially linkable, scattered information about domestic abuse. So we're really, I think, have some major evidence gaps here. I've just listed a few, the team has just listed a few here, opportunities, for example, linking children's social care data, criminal data, using the Police National Computer, crime survey. What can we do in this space to begin to put that information together? So here I think there's a major national imperative around building new national data assets. Obviously the work that's going on in foundations with Aoife's team, phenomenal in terms of looking at practice innovation around domestic abuse, but we do need to be able to again capture some baselines and get hold of the picture at scale. Okay, so another tricky issue, tricky subject, I think, but one that's really uppermost in our minds is thinking about inclusion, exclusion, thinking about minority groups. I think Grace has already set the scene for us here by saying that we've got some really good basic descriptive evidence, but some of our categories lack a bit of nuance. We're using fairly blunt population categories. What can we do to develop that? How can we combine different sources of data? But we have got some quite glaring gaps in evidence. Again, there's been some great work done on UAS, but we need to update that, and we need to do that at scale rather than at a specific regional level. We need to ask about, ask again about those interactions between ethnic minority status, those minoritized populations and their experience of services, given if you read Grace's full research review that she's led, there's some really quite concerning evidence there about late entry to children's social care, almost direct into court and placement for some minority ethnic children. Okay, so talking about populations that are quite excluded in lots of ways, we seem to be mirroring that a bit in our own activity, and how do we take that forward? Okay, so on to the next slide. I'm going to try and stop in a minute or so, Lucy. Obviously, another big question is around extrafamilial harm, major topic for us all, and again, quite a challenge in terms of how do we create the data sets to help us understand this. So I'm going to come to my last slide, I think now, Lucy. Evaluation research. Okay, so lots of debate, lots of questions around evaluation research. What we would say from our own analysis within the Catalyst is that we think evaluation research can benefit from administrative data. But we need to be careful about this. We need to understand the potential limitations. We need to understand what combinations of data we need here. But there's a lot more work to do. And again, I'm thinking about Will Cook, one of our ADR UK fellows, who's trying to use evaluation data in this space. I think learning from the ADR UK fellows is pretty critical in terms of helping us move our own thinking and practice forward in terms of evaluation research. Our standpoint within the Catalyst, I think, is that there absolutely is a place for these flagship data sets to contribute to evaluation evidence. Okay, let's go on to the next slide. Okay, so just finally then to wrap up, obviously government departments, we've got lots of new leadership. We are obviously going to keep an eye on research priorities, where they're shifting, how they're shifting. Eve has mentioned the new Children Wellbeing Bill. So it's important, I think, that our Catalyst also stays on top of and aligned to government priorities. That's, if you like, the whole ethos of ADR UK. So through our various workshops, we will be signalling, if you like, where the community needs to listen to and align itself with policy agendas and shifting policy agendas. Okay, I think another final message is that in speaking to stakeholders, Kat, we came across loads and loads of phenomenal local area innovation or regional innovation. And a question for this community is, how do we make use of that and how do we join up? Okay, I'm going to stop there. Thank you.
Thank you very much, Karen. We're running close to the wire here on time, so I'm going to ask Lucy is going to do some polling to get us warmed up for discussion. We've got a couple of questions in the chat, which we'll come back to in a minute. Over to you, Lucy.
Great, thank you. So we've just had a few questions for you, please, related to kind of your background experience and I guess some initial reflections from you on the research agenda. We'd be really grateful if you could just do this quick Menti with us. There's only sort of about 5 or 6 questions. So if you do have your phone to hand, please use the QR code or use the website. I'll just give you a couple of minutes to join. And then Grace, if we could go on to the first question, please. So first question for those of you who are able to participate. Do you think we've captured the main areas requiring further evidence in children's social care? Brilliant. Obviously hopeful it's going to be as blue as possible. But if you do think of other areas, then please kind of drop your thoughts in the chat or please do email us directly. Okay. Grace, did you skip a question? Was there one before this one? No, that's perfect. Great. Okay, second question then. So of the main areas for further research outlined in the agenda, which one do you think requires the most urgent attention? Yeah, I mean, I think this is really interesting to see. And then, yeah, of course, as we've outlined, there's the balance between what's possible now and what further sort of data linkages will help these areas, but certainly early help, children in need, and then the household level hardship areas coming up as forerunners currently. I'll just give you a couple more minutes because the numbers are still going up. Great. Okay. And in the essence of time, let's move on to the next question. Are you aware of the ADR England's large-scale administrative data research datasets? So mainly yeses so far, some nos, and again within our Catalyst webpage, we'll make those links clear, and then I'd also encourage you to visit the ADR website as well, which has a huge amount of information about the different data sets and where the data can be accessed. Okay, next question, please, Grace. Have you used these data before for research in this area? Okay, fairly even balance there, and we certainly hope that some of the Catalyst events and resources that we produce will help your journeys in this area. And last question, please, Grace. So what else do you need to start using or increasing your use of the ADR England's data sets for research in this area? Yeah. So funding, clearly always the issue. Again, ADR have got a really great web page for current funding calls that may be a possibility for your admin related research.
Thank you,
Great.
Lucy.
Thank you.
Thanks very much. And thank you so much to the team for those fantastic presentations. I've been keeping an eye on the chat. I'm going to ask the team a few questions. Lucy, do you want to put up your slide with more information? So Lucy's going to put up a slide with information about future events and where you can find more information during the Q&A. So you can have a look at that while we do the Q&A. I'm bringing some of the questions together, but one of the questions that I thought was really helpful is whether you think the unique pupil or the unique child identifier that the government would like to bring in, we don't yet know what that might look like, but do you think that this might help us overcome some of the challenges you raise or identify help with some of the gaps?
Yeah, Karen's nodding. My view on that is I think it would absolutely help us for research on the under fives, but also obviously better linkages between data sets as well.
Is there anything you want to add, Karen?
I think it would be a major step forward in terms of trying to understand children, especially the younger children.
Thanks. And Matt raises a sort of related question, which I think is really helpful, is you know, we only know what the data shows essentially. So there's something about what isn't in the data. And Matthew points to something here about lots of children who are not captured in the data, particularly when data are linked. And there's an example there of children in England who don't have a PMR. It is one of these things we've talked about for a very long time. So I wonder if you have any thoughts on how we might be able to press for change. Is there something government can do to help with that? Whether you have any thoughts on that?
I mean, I think the Catalyst can certainly pick up on all of these points, Matthew. Thank you for that. And obviously there is strength in collaboration around our requests for change. I think sometimes it's also, Matthew, about raising awareness that people don't necessarily know. People who can make changes don't necessarily know. Lucy, do you want to add anything?
No, nothing else to add on that one.
Thanks. And Neil raised a similar group of young people who aren't in the data. So young refugees, for example, who are not unaccompanied asylum seeking children. We know that there's a US flag, but otherwise refugee children aren't identified. Karen, there's a question here that you might be able to answer around school disengagement. Neil's asking whether school disengagement is the right term. Neil says there's a lot of resistance, in inverted commas, from schools across looked after children, CIN, etc.
Yeah, I mean that's a really helpful point, Neil. I mean, I think that was the point I was kind of trying to allude to, really, that some of our kind of blanket descriptors might not be the best fit. I think that's why engagement with families and the stakeholder, you know, when we talk about stakeholders, we mean families and communities as well, to understand the starting point for our analyses, so we're not kind of just jumping in and assuming our categories fit. Because I think school disengagement, from my limited knowledge, is incredibly complicated, and certainly where we use blunt categories, we're at risk of misrepresenting what's actually happening and how families themselves understand the issues. Does that help, Neil? Do you want to say anything yourself?
I'm just typing something in the chat, actually, so leave me to it.
Thanks, Neil. While Neil does that, I'm going to ask one last question before we turn to some slightly practical ones. So Amy asks, in terms of early intervention and prevention, would it be beneficial to link with universal services such as health visiting, school nursing, where those services still exist in a universal sense? Health visitors visit every family with children under 5 and would have depth of knowledge in many areas covered.
Yeah, I mean, I would say absolutely, that would be incredible, wouldn't it? I think it's just collating, making those data available, really. I think that's the current limitation, but we really need to, it's that more on the ground kind of what's going on that we need to understand. Even, you know, we have data sets like the children in need and children receiving care and support, but really understanding, you know, what they're actually receiving would be incredibly helpful.
Yeah, and there is some work going on to build some regional data sets. I don't think Dougal's on the call, is he, today, Lucy?
I think maybe.
Is he on the call? Dougal, do you want to just come in for a second and just post in the chat? But obviously at regional level, there is work being done to link in that kind of health data. I mean, I think another key issue for the ADR community is what combinations of data do we need to complement population scale data such as this. You know, there's a qualitative imperative around this as well.
Thank you both. There's still lots of comments and questions coming in the chat, which we will collate at the end. The slides will be shared for today, as will the recording. And Lucy, I wonder if you want to say a few words about what's on the slide, given that a few people are asking questions, how to get involved and what the workshops involve.
Absolutely. So again, this is the website that takes us to our microsite. So as we organise these new events, we'll post updates and registration details. The one workshop that's currently flagged on the website is our first research design workshop. So that workshop is focused for, I think those that will benefit most will be kind of early career researchers or mid-career researchers, people interested in putting or drafting their first funding application for research in this area. So we have sort of the project team who have presented today will be present, and then we'll also bring in other experts who have used the data sets. So Matt J, who I think is on the call today, will also join us to cover insights around the eChild data set and access, etc. And then the other events still to be confirmed, whether they'll be webinars or in-person events. But as you can see, we're picking up on some of the major themes that we've identified. So again, a session on measuring deprivation, workshop around evaluation and using admin data for that, a workshop focused on early intervention, another research design workshop, and then Dougal will lead a session on his linked local data. But I'd also really encourage you to visit the Children's Social Care Data User Group website as well. I think Jenny's on the call, so Jenny Woodman and Lisa Hongs co-lead this group with Nikki Luke. So yeah, lots of really helpful resources there and opportunities to engage with their events as well.
Fantastic. Thank you so much. I think it just remains for me to thank the team. Thank you everybody for coming along today, for your interest. Please do check out the slides and the website after today and get in touch if you have any questions or any follow-up. Thank you again so much, everyone. Have a great week.